If you missed information on any of today's guests, make sure you head over to our website at WNYLiving.tv to find out more about all the segments on today's show. You'll also find archives of past shows and clients. It's all on the web at WNYLiving.tv. Now let's head back to the Western New York Living studio.
And glad you're with us on this Saturday morning. All right, easy and convenient, something many of us strive for throughout our lives. Sometimes we take shortcuts, but sometimes taking the shortcut isn't always helpful in the long run. Case in point, hearing aids. And joining me this morning to bring some insight into this topic is Dr. Jill Bernstein from Hearing Evaluation Services of Buffalo. Dr. Bernstein, good to see you again.
Thanks, good to see you.
All right, we've just had some new legislation, which everybody loves legislation, don't we? Came into effect. It's dealing with over-the-counter hearing aids. What can you tell us about this legislation, and what are your patients asking you about these hearing aids?
Yeah, so this was a long time coming. It was supposed to come out in 2020. And this new legislation from the federal government creates a new category of hearing aid that can be available over the counter. So the idea is it's really designed for people with more mild difficulty with their hearing and to give them another access point to getting help with their hearing. Most patients or folks who have mild difficulty aren't coming to see audiologists. So as an audiologist, who always wants people to hear the best they can, it's our hope that this provides another pathway for them to start getting help. But it is really designed as an entry point for more mild to moderate difficulty with hearing. So what we recommend really is if it's something someone is interested in pursuing, the first step is to come and see us, come see an audiologist. Let us test your hearing first to make sure that this is a category that's appropriate for you so that you'll get appropriate benefit. And then you can opt to go that way or to see an audiologist.
Yeah, it's in the title of your business, Hearing Evaluation Services.
Right.
You're going to tell the patient who comes in, like, hey, this would be good for you, or perhaps you need something more advanced, and that's where you come in also with hearing aids that you fit your patients with. Tell us about the difference between those and what they'll find over the counter.
Yeah, so Hearing Evaluation Services, we're actually a nonprofit practice, and therefore, our goal is to make the best recommendation for someone and give them all of their choices. Also, we want to make sure that when they come for their hearing test, that it's not something really simple, especially if it's mild difficulty. See plenty of people who just have earwax, and that's something we can so easily correct. If there's an actual hearing loss, the experience will be very different over the counter versus in our office. Over the counter is really about an independent process. You have to self-select, self-program, and self-maintain your hearing aids. There's minimal, if any, support for you in that area. When you come see an audiologist, we're evaluating your hearing, but we're also doing another evaluation looking at your communication needs. And we have a broad range of products that we can choose from. What you're going to get over the counter is going to be more what we would consider now to be a very basic entry-level device, where we have a lot of other choices to particularly target some of the more problematic areas like hearing and noise.
I do want to mention here in the time we're remaining, you also offer pediatric care in dizziness and imbalance issues.
Yes. We do everything related to the ear and the auditory system. For children, it's super important if there's any speech or language delays to get their hearing checked to make sure that's not the issue. They're in a very critical period of their lives. For people who experience dizziness, which is one of the most common reasons people see their physician, if it's ear-related, audiologists are the ones who do the testing for that.
See, everybody's learning something here on today's show. Dr. Bernstein, thanks for joining us here. Hearing Evaluation Services of Buffalo. They have 4 office locations across Western New York. You can find them in Amherst, Williamsville, Orchard Park, and Tonawanda. To find out more about all of the hearing services they provide, head over to their website at hesofbuffalo.org, or you can call them, the number you see on the screen. They can help with any hearing-related issue and balance issues that you might have. Now, coming up next, Fredonia Place Assisted Living and Memory Care will be joining us to talk about the different senior living options they offer at their Fredonia and Williamsville communities. Western New York Living will continue.
This segment of Western New York Living was sponsored by the following: